A psychiatrist, this already sounds like a joke. A psychologist, a psychotherapist, a counsellor and a coach. It can all be very confusing unless we know. So I'll share with you what I know as a psychotherapist and a psychologist and a coach with 30 years practice working globally with all different kinds of people. My name's Poppy. I'm unaffiliated. I work for you. Some people ask me about me, so I'll tell you a little bit about me as well in case you're interested. So, a psychiatrist has a medical degree. Their job is really to look at diagnosis, what you may be having symptoms of, to help you understand that, and where appropriate, to medicate, to offer medication, to offer treatment follow-ups, reflections of how's the medication working, is it the right one, and so on, because it can be quite a challenge to find, biochemically speaking, what works best for you. What I would say is, as a patient, look up your symptoms yourself and do what you can, and or have support from other people that you trust to have a look at, do the symptoms, the traits of the problem that you're having, the challenge, marry up with something that's in the DSM-5, which is the Diagnostic and Statistical Manual that's used certainly in Britain, that looks at traits, personality disorders, mood disorders, and so on. You can look that up online if you don't have the book, obviously. Check yourself. Please ask us questions as healthcare professionals, and I understand it's challenging because we often feel, oh, I don't want to upset. You get to ask the questions you want the answers to. And I would say if any healthcare practitioner gets defensive or difficult with you, I take that as an indicator that there's a problem at their end. You get to trust. Behaviour is a language of its own. Feel your way. The heart develops before the brain for a damn reason. 2 seconds, ask the question. Do I feel safe? Is this right for me? Yes or no? Listen, take it seriously, respect yourself, and take action on the back of that. A psychotherapist, there's lots of different kinds of psychotherapists. However, we'll have a number of degrees, or at least 2, undergraduate degree, which is often a generalization of something. So for example, with me, I have an undergrad in psychology and psychotherapy. Then there's a second degree, postgraduate training, and that can be for psychotherapists, it can be integrative. There's lots of different kinds of titles that can go with somebody's psychotherapy label. So again, you get to ask, what treatment approach are you using? And some people are integrative, meaning it takes lots of different approaches that we've learnt about in university, and we've had client placements where we've gone and used that particular method, psychoanalysis, psychodynamic, humanistic, mentalization, you name it, systems approaches. Ask us. However, what the research says is that it's not the method or the modality or the treatment approach that actually is an indicator of a good outcome, successful therapy. It's the relationship you foster with the therapist or counsellor or coach, or if that person resonates with you in the way that you need at this point. Again, ask the questions. A counsellor, in my opinion, however, counsellors may say something different, is they essentially hold space for you to talk. It's not as analytic and so on. Hopefully, your healthcare professional, if it's about mind and behaviour, will have their own therapy. Not all do, and not all are expected to. Hopefully, they also have mentors, people who they're supported by in some kind of way for continuing their learning postgraduate. After the graduation, they continue to learn. In my opinion, I teach and coach and supervise as well. To me, it's imperative that we have a lifestyle of health if we're in the healthcare field. That means investing in your own development as you go. So we're learning and training and getting better and up to date with contemporary research about what works for whom and why and so on. Clinical supervision is where counsellors and therapists and so on, they go to another counsellor, therapist, psychologist and so on, and they talk about their clients confidentially so that we get to look at ourselves and our responses and our feelings about the work that we're doing with other people, because we're human. So sometimes we'll have, feelings where we feel super protective of you because we care, and or because it touches, something we've been there. So we want to make sure that we have our own human stuff in check, so that we're not basically projecting onto you. That's never going to be helpful. So we get to have other people having our back. So we have your back, and ideally someone has ours. Again, please ask the question. Psychologist is different again. However, again, please ask the person, where essentially it's the science of mind and behaviour. So sometimes it's very much a clinical thing that we're reading and understanding and looking at research and so on. And sometimes that involves talking therapy as well. And there's specialisms that we can go into. So it may all be a bit overwhelming. However, again, please, and if you don't feel you can have these conversations, we're not direct in our culture, we're not taught it. Take someone you care about with you, or email the person as a follow-up. I'd just like to check X, Y, and Z. Coaches, different again, is coaching field is unregulated. And what I mean by that is you don't have to have a training. So essentially, if you wanted to open up as a coach and you've got no life experience of anything, no training, no practice and so on, you could open up as a coach of, I'm a, curtain coach, or there are some excellent coaches. There are some excellent everyone. Some people are mentors, which just mean they guide you in some kind of way. Coaching is more directive, to tell us what to do, how to, be accountable to goals and so on. Psychotherapy and counselling, and usually psychology, is reflective. So us as clinicians, we don't direct you or give advice particularly that much. Coaches will, email me with this, photograph me with that, and so on. I integrate them because for me, it's really important that we know where we've been, what shaped us, what kind of beliefs and so on, biases do we have, and how might it be getting in the way now that it's tripping us up, we're doing the same thing over and over again, attracting the same kind of people, and so on. And the psychology is for you to learn how you think, how you feel, and how you behave, so that you can thrive. And that's my business. The Academy for Self-Mastery Ltd is a specialism in what you're thinking, what you're feeling and doing, so that you're not one of those people on their deathbed, the top regret of the dying, who say, I wish I'd have had the courage to live my life rather than the life I thought other people expected of me. That causes so much grief and pain and trauma transgenerationally when we live a life based on what we feel other people want us to do. However, we're invited and groomed to do that in our culture. For me, for most of my career until quite recently, I was affiliated with or registered with different governing bodies. And that often is the case for most people who are licensed. So you want to ask about that as well. What are your degrees in, if you choose? What's your experience? How long have you been practicing? What do you charge? Why? Etc. Who's supporting you to support me? And are you registered? And if so, where? Are you insured? In which case, where? Do you have a contract or an agreement form and so on? I do, because it's very important that we have agreements up front about what's going to happen and what's not going to happen. And it's just a gentleman's or a gentle lady's agreement that says we're clear on the boundaries moving forward. For me, I realised a long time ago that in the healthcare field, freedom of speech is not a thing, even though it's an inalienable right that we all have when we come to Earth, every person on the planet, inalienable rights. One of them is freedom of speech. However, in the healthcare field, that's not acknowledged and usually not allowed. We're guided, certain things you can say and not say. That doesn't work for someone like me, particularly given the 1.0 of my life was can't speak. So for me, I'm not going to invite my clients and students and so on to discuss truthfully what they're feeling and what they want and don't want if I'm not prepared to do the same thing in my life as a lifestyle. Equally, there are 3 other hugely important things in healthcare. One is Hippocratic Oath, do no harm. The other is Nuremberg Code, which says we cannot experiment on the public, please. And the other is full and thorough informed consent, meaning all clients, patients and the public get to have from healthcare providers and professionals full and thorough, unredacted information, uncensored, non-biased information at your fingertips, that we're offering you that so that you can make full and thorough informed choices about your health, about medication and so on. In the healthcare field in Britain, certainly, well, no, we can talk globally at this juncture, clinicians are basically told they can't do those. So whilst some people may disagree with me, I know through personal experience that wanting to talk straight, wanting to inform the public because I've done my due diligence and keep up to date with research and cross-reference it and look at who sponsored studies and so on, I'm not supposed to talk about that, and I'm certainly not supposed to challenge the organisations who do not talk about that and who punish people like me who do. Hippocratic oath is very important to me, and certainly experimentation on the public is gross and genocidal and not doing it. Therefore, I work for me. My company has its own ethics and guidelines for how I treat people when I work with them and my programs and so on. And I have therapists, supervisors and coaches to keep me in check when and if I'm being human over here, and my love of humanity sometimes gets sparked when I see injustice. So I work for myself and I work for you. None of my work and or what I'm saying is redacted. That's a bit of me. I hope it's useful about a bit of other stuff. Bottom line is, ask the questions and listen to what it feels like when you hear the answers. Send in love.